Hello, everyone, and thank you for joining us for the New to Medicare Foundations of Part C webinar. My name is Bailey Lawson. I am one of the specialists on the Provider and Outreach Education team, or PO team at WPS, and I'll be your speaker today. Assisting me today is my friend and colleague, Mary Muko. You heard her voice a little earlier. She will be monitoring the chat and helping me during the webinar. You may hear her voice during the Q&A portion at the end of the webinar. But yeah, that's Mary. You'll hear her. I do have some housekeeping to share with you before we get started today. We do have training materials available on our website. If you haven't downloaded that yet, you can do so by going to the Training Center webpage. It's on the Live Events webpage, and Mary will put a link to that in the chat for you as well. And you can download the materials by clicking on the hyperlink of the words that say handout materials, I think it is, or webinar materials. But click on those words and you'll be able to download that. You can send your questions and comments in the chat and Mary will monitor that for me. And of course, following our event today, you'll be able to tell CMS and WPS how we did, or what else you would like to see on a brief survey, which is specifically to get our learners' feedback. This doesn't have to be specific to Medicare. Just let us know what you need from us. We begin our event today with this disclaimer. We include this disclaimer in all of our events. We do so in order to remind learners, although we've made every effort to provide current information that is correct, it is subject to change. It is on the CMS website where you will find those laws, regulations, and rulings that determine final coverage, and it is those that will always prevail. Just as a reminder, CMS does prohibit recording of this presentation for profit-making purposes. We are recording it, and we will have this as an encore. So if you do want to go back, you will have the opportunity to do so. It will be on our encore presentations page as well as our YouTube channel following this event. It may just take a few days to see that. Alrighty. So this is a part of my New to Medicare series. I know a lot of you who signed up for this event are new to Medicare and have a very, very baseline amount of knowledge. So I want to tell you that I'm doing different topics on a monthly basis. Next month, which actually isn't all that far away, on October 6th, I will also be hosting a webinar. It's just on Medicare Part D instead of C. I also do want to let you know about a big event that we are hosting in October as well, and would be beneficial for you who are new to Medicare. And this is our Medicare Education Expo Medicare Madness. Oh, mouthful. This is a spectacular event that will guide you through the Medicare claims process. It's in October, so naturally it's Halloween themed. It's very fun. But I just wanted to give you that information ahead of time so that you know of the resources available to you as people who are new to Medicare. But getting started with today, on the agenda, we will be covering Medicare Part C, and my goal is to help you understand it by explaining what Part C is, going through the different plan types, and describing how it is different from original or traditional Medicare, whichever word you use. I do want to preface also by saying we at WPS don't handle things having to do with Medicare Advantage plans Part C. We are Part A, Part B, but I did want to get this information out to you. So a lot of the things that you will hear today, and it may be frustrating is that a lot of it varies from plan to plan, and we don't have the answers. That's something you'll have to ask that specific plan provider for answers and clarification on. We just have the general information of Part C. Okay. Diving into what Medicare Part C is. Remember, when we talk about Medicare Part C, it is the same thing as Medicare Advantage. This plan is separate from original or traditional Medicare or Part A and Part B. Although it is separate from original Medicare, this plan covers what Part A and Part B Medicare covers. Medicare Advantage can even cover more, such as drug coverage. So Medicare Advantage gives this kind of coverage through private insurance plans offered by Medicare approved companies. So when I say go earlier, when I said go to the plan provider if you need specific questions answered about a plan, go to the provider. This is what I mean. The Medicare approved companies that offer these insurance plans. These plans must offer what original Medicare offers and no less. Who a person gets coverage through depends on where they live and what is available in that coverage area. These plans also have different things that can vary plan to plan, like premiums, deductibles, and out-of-network policies, just to name a few. So the beneficiary needs to do some research and figure out what kind of plan will suit their needs best. It's not all that different from doing research for yourself when you're picking a plan through your employer. If you do that, you may research things to understand the plan better while keeping in mind the kind of care you receive on a yearly basis. Do you receive a decent amount of specialized care where a high deductible is easily met? So then you have more covered once that deductible is met? Or does a lower deductible make more sense because you don't receive a lot of specialized care, so you won't easily meet that deductible, so it won't even matter? These are some things a person looking at Medicare Advantage might ask themselves. In order for a person to be eligible, there are a few criteria they need to meet. So first and foremost, a person needs to be eligible for original Medicare. And as a recap, that includes those over the age of 65, those under the age of 65, and has been deemed disabled via the Social Security Administration or Railroad Retirement Board, and those diagnosed with end-stage renal disease. A person must also be enrolled in both Part A and Part B Medicare. Remember, a person is not automatically enrolled into Part B. They have to enroll. Unlike with Part A, they have to opt in. So this is something that could affect eligibility to Medicare Advantage plans. The next thing that determines eligibility is living in the service area. The plans aren't one for all. There may be a company a person wants to go with, but they don't offer a plan in the area of service that that person is living in. That would be, they can't go with that company, or maybe even the company has a plan and it just isn't the plan they want. They will need to pivot their plans and fit what they're eligible for. So it could be the company they want, but not the plan they want, but the plan is not available for their area of service. So they're going to have to figure, a different plan if that plan is really something that wouldn't work for them. And lastly, they will need to make sure that they enroll during open enrollment. There are a couple of stipulations that will change enrollment dates a bit. So the initial enrollment period for someone who is new to Medicare will start 3 months before receiving benefits and end 3 months after getting Medicare. This is where they will opt in for Part B if they want it. which they will need it for Part C, because remember you have to have both Part A and B in order to be eligible for Medicare Advantage Part C. There's the initial enrollment period for those who are new to just Part B, which could be different than the initial enrollment if you don't originally opt in when you become eligible for Medicare. So you already have Part A, but not Part B yet. For this, you will have 2 months after enrolling in Part B to enroll in a Part C plan. Then there's regular open enrollment, and that is October 15th to December 7th. A person can join, drop, or switch to another Medicare Advantage plan. There is then a Medicare Advantage open enrollment, meaning you already have a Medicare Advantage plan, and that is January 1st to January 31st. This is when a person can switch to another Medicare Advantage plan and drop it altogether and return to original Medicare. There are certain circumstances where there is special enrollment period, and this varies with things like moving to a new address, meaning the person is no longer covered because they are outside of that area of coverage for that plan. Losing or changing current coverage, getting Medicaid or getting extra help to pay with drug costs. It is a little confusing, so I will have Mary add a resource into the chat so you can take a look at what I'm saying just to see it visually. I'm also going to have her add a resource that tells you how to check eligibility and what kind of plan a patient has. And she'll send that right there in the chat. Next, we are going to dive into the different types of plans that are available for Medicare Advantage plans. There are a few, but I'm going to cover the popular ones first. Something I do want to preface with is that each plan is different. So you'll see a lot of things that say varies by plan within the handout materials. And I was kind of saying this earlier too. These are things that we at WPS have no control or knowledge of. These are questions that need to go directly to the plan servicer. We don't handle anything having to do with Medicare Advantage plans. And again, I did just want to do this education so we can further your base knowledge if you are super new to Medicare during your journey with Medicare. But just know that a lot of these will vary by plan. Okie dokie. So the first popular plan is a health maintenance organization or HMO plan. An HMO plan is a type of Medicare Advantage plan, Part C, offered by a private insurance company. When you have an HMO, you generally must get your care and services from doctors, other healthcare providers, and hospitals in the plan's network. And this is the exemption for that is emergency care, out of area urgent care, and temporary out of area dialysis. Some HMOs are point of service, HMOPOS plans that may allow you to get some services out of network for a higher copayment or coinsurance. These plans aren't as common as just a flat out HMO. It's important that you follow the plan's rules, like getting prior approval for a certain service when a plan requires it. These plans usually charge a premium in addition to their monthly Part B premium. These typically have lower premiums, lower copays, and lower coinsurance costs. Although this is a more affordable option, it does not have as much flexibility as other plans in network. providers. With this plan, a primary care physician or PCP is required, and you need a referral in order to see a specialist in most cases. This varies by plan, but an example of that would be uh, uh, sorry, not something that would not require a referral would be something like a yearly mammogram screening, but again, it varies by plan. That's just an example. This plan does not pay for out-of-network visits except for, like I said, emergency, urgent care, or out-of-area dialysis. Otherwise, the cost of care will be the beneficiary's responsibility. These plans do typically offer drug coverage. This is something that also varies by plan, so the beneficiary will have to check to see if the specific plan has coverage. If they join a plan that does not offer drug coverage, they cannot not join a separate drug plan. If they are someone who doesn't need a lot of specialist care or doesn't mind having their care coordinated through a PCP, they can save some money with an HMO plan because, like I said, lower premiums, lower co-insurance, lower co-pays. A preferred provider organization plan, or PPO plan, is another type of Medicare Advantage plan offered by private insurance companies. PPOs have networks of doctors, other healthcare providers, and hospitals. You will pay less if you go to providers and facilities that belong to the plan's network. You can generally go to out-of-network providers for covered services, but you'll usually end up paying more for them. This type of plan usually charges a premium in addition to the monthly Medicare Part B premium. A PPO plan does provide more choices when it comes to your healthcare, but there will also be higher out-of-pocket costs associated with these types of plans. The monthly premiums will be higher, and the co-pays for office visits will also cost more. On top of that, there is also an annual deductible that must be met. To help reduce costs, remember that using in-network providers, doctors, and the other healthcare professionals who are part of that specific PPO network will save money. Unlike an HMO, a PPO offers the freedom to receive care from any provider in or out of your network. This means you could see any doctor or specialist or use any hospital. If you find yourself in need of medical care when you are away from home, you can see any healthcare provider you choose. In addition, PPO plans do not require you to choose a primary care physician like the HMO did, and do not require referrals. For example, if you already have a doctor you like, you can continue receiving care from that provider. If you need to see a specialist, you don't have to first consult with a PCP either. No referrals are required for any doctor, specialist, or hospital. Unlike the HMO plan, but just like with an HMO plan, with a PPO plan, it usually has drug coverage, but you will need to make sure that that specific plan offers it because you cannot, again, not join a separate Medicare drug plan if the PPO plan does not cover it. Private fee-for-service plans, or PFFS plans, are offered through private insurance companies as well. You will pay healthcare providers directly for services based on an amount that your plan determines. PFFS plans aren't the same as original Medicare or Medigap. The plan determines how much it will pay doctors or other healthcare providers and hospitals and how much you must pay when you get care. They still charge a monthly premium in addition to that monthly Medicare Part B premium. The plan decides how much you pay for the service or services you're receiving. The plan will tell you your costs in the annual notice of change or evidence of coverage that it sends each year. You'll need to show your plan membership ID each time you're visiting a healthcare provider. The provider can choose at every visit whether to accept the terms, this kind of plan's terms and conditions of payment. A person can't use their red, white, and blue Medicare card to get healthcare because original Medicare won't pay for your healthcare while you're in a PFFS plan. The beneficiaries will want to keep their Medicare card, though, in a safe place in case they do return to original Medicare in the future, because they'll use that again. A PCP is not needed for this plan. You can go to any Medicare approved provider or facility that accepts the plan's payment terms, agrees to treat you, and hasn't opted, sorry, I was fumbling over my tongue, hasn't opted out of Medicare for Part A and Part B covered items and services. If you do join a PFFS plan that has a network, you can see any of the network providers who have agreed to always treat plan members. You can also choose an out-of-network provider or facility who accepts the plan's terms, but you may end up paying more. In an emergency, doctors, hospitals, and other providers must treat you. This plan will sometimes offer drug coverage. It varies by plan again. If a PFFS plan doesn't offer drug coverage, you will need to join a separate Medicare drug plan to get drug coverage. So this is different from HMO and PPO, where if it doesn't cover drugs, you can and will want to get a Part D plan, drug plan. Okay, so a special needs plan or SNPs are vastly different from the others in the way that they provide benefits and services to people with specific severe and chronic diseases, certain healthcare needs, or who also have Medicaid. These are one of the lesser likely, or yeah, these are a lesser likely plan you will come across in Medicare Advantage. Sorry, the grammar didn't sound right there. SNPs include care coordination services and tailor their benefits, provider choices, and list of covered drugs to best meet the specific needs of the groups they serve. SNPs are either HMO or PPO plan types and cover the same as Medicare Part A and Part B benefits that all Medicare Advantage plans cover. However, SNPs might also cover extra services for those special groups that they serve. For example, if you have a severe condition like cancer or congestive heart failure, or you need a hospital stay, an SNP may cover extra days in the hospital. You can only stay enrolled in an SNP if you continue to meet those specific conditions of the plan. So the requirements for SNPs are that you have Medicare Part A and B, you live in the plan service area and you meet the eligibility requirements for one of the three types of SNPs. And those are one, dual eligible SNPs, or if you see an acronym, it's DSNP. Chronic condition SNP is number two, and that acronym is CSNP. And then the last one, institutional SNP or ISNP. For dual eligible SNP, you have to be eligible for both Medicare and Medicaid. Some DSNPs may provide Medicaid services in addition to Medicare services. DSNPs contract with the state Medicaid program to help coordinate your Medicare and Medicaid benefits depending on the state and your eligibility. For chronic condition SNP, you have to have one or more of these severe or disabling chronic conditions: chronic alcohol and other dependence, certain autoimmune disorders, cancer, excluding precancer conditions, certain cardiovascular disorders, chronic heart failure, dementia, diabetes, end-stage liver disease, end-stage renal disease requiring dialysis, and that's any mode of dialysis, certain severe hematologic disorders, HIV or AIDS, certain chronic lung disorders, certain chronic and disabling mental health conditions, certain neurologic disorders, and stroke. And for the last one, institutional SNP, you have to live in the community but need the level of care a facility offers, or you live or are expected to live for at least 90 days in a row in a facility like a nursing home, intermediate care facility, skilled nursing facility, rehabilitation hospital, long-term care hospital, swing bed hospital, psychiatric hospital, or other facilities that offer similar long-term healthcare services and whose residents have similar needs and healthcare status as residents of the facilities of the ones that I previously listed. A lot of the info on SNPs varies by plan, and this would be something that is needed to talk to the insurance company that the plan is through for specifics. Premiums are one of these things. They vary by plan. Some plans may charge a premium in addition to monthly Part B premium. However, if you have Medicare and Medicaid, most of those costs will be covered for you. Choosing a PCP also varies by plan, just like needing a referral varies by plan. Something that all SNPs do have is a care coordinator to help you stay healthy and develop a care plan with you. And all SNPs must provide drug coverage. Some more specific things about the plans. The plan is that DSNPs can help coordinate your benefits between Medicare and Medicaid. If you're interested in an ISNP and live in a facility, you can check that the plan has providers that serve people where you live. And CSNPs can limit membership to a singular chronic condition or a group of related chronic conditions. So very, very plan specific for this specific type of plan. Medical savings accounts, or MSA. A MSA is a type of consumer-directed Part C plan. These plans are very similar to health savings account, or HSA plans. Sorry, there's so many acronyms today. Plans, and they're like what you'd get from your employer, the HSA plans are like what you'd get from your employer. With MSA plans, you can choose your healthcare services and providers. These plans usually don't have a network of doctors or other care providers or hospitals. They have two parts. MSA combined a high deductible insurance plan with a medical savings account to help pay for healthcare costs. You're responsible for handling the money in your account, including deciding whether to pay for healthcare services using your account funds or other funds you have. So part one, high deductible health plan. This is a special type of Medicare Advantage plan. This type of plan only starts to cover your costs once you meet a high yearly deductible, which varies by plan. And then the part two of it, the medical savings account. It's a special type of savings account. Medicare gives the plan an amount of money each year for your healthcare expenses. This amount is based on the specific plan. The plan deposits money into your MSA account once at the beginning of each calendar year. Or if you become entitled to Medicare in the middle of a year and you join a Medicare MSA plan at that time, the plan will then deposit the money into your account the first month of your coverage, the first month that your coverage starts. You can use this money to pay Medicare covered costs before you meet the plan's deductible. You can access the money using a checking account or a special debit or credit card that your bank gives you. You'll just have to check with the specific plan for details on that, because again, it varies by plan. The yearly deposit and yearly deductible are prorated based on when the eligibility, when the enrollment is, when your eligibility begins, and then you enroll. It's prorated based on that. MSAs may also pay for some qualified medical expenses. And qualified medical expenses are generally the same types of services and products that you would deduct as medical expenses toward your Medicare MSA plan deductible, only if the expenses are for Medicare covered Part A and Part B services. These services may include, doctor's visits, lab tests, and hospital stays. With these plans, there's, again, no monthly premium, but you do continue to pay that monthly Part B premium. Doesn't require a PCP or referrals to see a specialist. It does not offer drug coverage either, but some MSA plans may cover extra benefits like dental, vision, and hearing services. It may just be an extra premium, or, there's an extra premium for that extra coverage, or a higher premium for that extra coverage. This is just, again, another thing that you would have to check with this specific plan. If a person were to use all of the money in their account and they had additional healthcare costs, they'll have to pay for the Medicare covered services out of pocket until the plan's deductible is reached, and then coinsurance takes over and stuff like that. Any money left in the account at the end of the year just stays there and may be used for healthcare costs in future years. It rolls over. I know when we're talking about HSA versus FSA, FSA doesn't roll over and HSA does. So it's kind of like that, where it does roll over. I added this graphic because these are the two most popular plans, the HMO and PPO, and then you could tell from my other slides when I was speaking that some of the other types of Medicare Advantage plans take from PPO. It's a type of PPO and stuff like that. So these are the most popular. I'm a visual person, so this kind of graphic helps me to differentiate the two plans in my head and keep them straight. And you're seeing it all at once too, so that really helps. I broke it down by categories. So the first is cost. Then next is in-network, out-of-network flexibility. Then we have provider network availability, and then whether or not a PCP is needed, and then whether or not you need a referral in order to see a specialist. Hopefully this benefits you like I know it benefits me. I know we just went over all of this information, so I won't talk your ear off about what's within the graphic, but I did want you to have that in case you needed to quickly pull something up and compare the two, because like I said, these are the most popular ones. Okay, next we are going to talk about how Medicare Advantage differs from original Medicare. I have made these into charts straight off the bat for your viewing pleasure. And like I said, I feel like it helps me understand better when I see things as a visual learner and they're side by side so you can quickly compare them rather than flipping back and forth between, slides. Okay, so first we have, we're going to talk about doctor and hospital choice. As you can see here with original Medicare, you can go to any doctor or any hospital in the US, but they have to accept Medicare. For Medicare Advantage, it is a little different where the provider needs to be in-network in most cases. But remember, ER visits don't have to be in-network. For specialist visits, you can need a referral for both original Medicare and Medicare Advantage plans. But again, check with the plan provider and the specific plan because it does vary for Medicare Advantage. Like I stated earlier, with PPO, a referral is not necessary. So it's, again, varies by plan. The next category is cost. For original Medicare for Part B, specifically, you will pay a deductible, and then once you reach that deductible, you will then pay a coinsurance of 20% of the cost of the service. So Medicare will cover 80%, you'll cover the missing 20%. With Medicare Advantage, it all varies by plan. It's hard comparing because with Medicare Advantage, a lot of things vary plan to plan. So it can be a little frustrating trying to explain the differences, but truly it varies from plan to plan with Medicare Advantage because they're very different. As far as premiums go, Part B of original Medicare has a premium, and that will always be something a person pays as long as they have original Medicare or Medicare Advantage, unless they're receiving some sort of help. If you remember back to my explanations of Medicare Advantage plans, you will pay the Medicare Advantage premium while still paying the Part B premium. And these, again, the premium amounts do vary plan by plan. There are some programs, like I said, that help those who can't afford the premiums, but typically there are premiums for both. With original Medicare, there's no out-of-pocket limit. Remember how I said there was a 20% coinsurance? Well, there's no limit to that. And what I mean by that is with Medicare Advantage, there is a limit. So let's say there is a Part C plan that is set up like Medicare Part B, where you have a deductible of, let's say, $5,000. You reach that deductible a couple of months in, and now you are having to pay the coinsurance portion. The difference would be that you now spend, let's say, the cap is $2,000. So you reach the deductible limit, and now you have a co-insurance limit, and that's $2,000. And then once you reach that $2,000, you pay $2,000 only on co-insurance. Now everything is covered by that insurance. So the plan will have something that says something along the lines of total out-of-pocket cost $7,000, and that's it. Once you reach that amount, you're no longer paying anything. The plan covers everything else. And that's all the beneficiary pays out of pocket is that $7,000. But original Medicare doesn't have that total out of pocket limit. Once you reach the co-insurance amount, you just pay, and then these reset on a yearly basis. So the deductible amount will go back to zero, and then the whole process will start over again. That's why I said earlier, it's really important for a person to do their research on the plan type, because if you're a person who can reach that deductible in 2 months, and then you have 10 more months of free healthcare, not free, but covered healthcare, then that's the plan you would want to pick. But if you can't reach that high deductible and you're paying all this money and you get no coverage because you can't reach that deductible, then that wouldn't make a whole lot of sense, right? So a person just needs to really look and see and think about their medical costs. Like for me, last year I had a baby, but I couldn't predict that those costs were going to come to me. So if I had known, and that it was going to end up in a C-section, or, whatever the case may be that makes it more expensive, then I would have reached that deductible quicker because of all these Medicare or medical expenses. But because, pregnancy is not a continued thing, cost of care, it's not something that you can't choose your plan. But you know what I'm saying? Hopefully that makes sense what I'm saying, that, based off of the care you receive, you can kind of tell how much you're going to spend a year in medical expenses. Okay, moving on to coverage. So you'll see, and I've stated it previously, but Medicare Advantage plans do need to cover what original Medicare covers and no less. This is based on medical necessity. You can see here in the chart that the parameters of medical necessity vary plan to plan. The last part, and the last part of coverage is prior authorization, which with original Medicare, you typically don't need prior auth, but with Medicare Advantage, you will need prior auth in most cases. But again, this is another thing that varies plan to plan. I am also seeing the spelling errors in the bottom of this graph. And clearly my baby was going through a sleep regression or something when I made these, because I'm not even sure how some of these spelling errors happened, and I apologize for that. Okay, so we've got some resources. I've listed out a lot of them for you here, but I do want to show you some, and I'm just going to drag these over. This right here is our YouTube channel, and I want to point some things out for you. So we've got some playlists out here, and if you look, these are not, okay, so we've got new to Medicare, and like I said, a lot of you are new to Medicare. So this would be very useful for you, because this is all directed for people. And when we say new to Medicare, it's 6 months or less. So these are all resources that would be beneficial to you. So if you missed my new to Medicare overview, you can go watch that again. Part A, we've got a Part B one somewhere in here, so you can learn the parts. But we've got claims basics, we've got the resources basics, so many things that would be helpful for you. But I'm going to go back. If you look through here, we've got them listed out broken down very specifically. So if there's something that you're needing help with, and these new to Medicare things don't this series doesn't go as specific as you need it, try looking in here because I'm sure there is something that covers what you're wanting to get information on. Prior authorization, I mentioned that within this webinar. Here's prior authorization. But yeah, take a look. There are a ton of videos, and then we have an encore playlist, and that's every video or every webinar that we record and we post. It's all here. There's 442 videos. So I guarantee you'll find something that you need there. The next one that I want to show you, and I have it linked in the handout, but I want to show you is the Medicare and You handbook. And you'll just click the download and it pops open. This has got a ton of information for you. We're talking about Medicare Advantage, so I'm just going to click and go there, but we've got a whole section, and you could see healthcare, HMO plan, MSA, PPO, PFFS, SNP, all we talked about today, and it outlines it for you. This is what is given to patients, so it is from the patient perspective, but I do think it's a very good resource to have as a provider. The next thing I want to point out is, I believe I have this link sent to you, but this is healthcare, again, outlined everything I talked about, all of the plans for Medicare Advantage. You can compare all the types, and then it comes up with this cool graphic for you, kind of like how I made for you in my handouts, but it answers questions like, is there drug coverage? Do you need a PCP? Do you need referrals? Just all these things. So I wanted to give this to you. This is on Medicare.gov. So again, this is from the patient perspective, but I think it's a great thing to look at as a provider yourself. And then the last thing I want to show you before we wrap up for questions is the Medicare Education Expo. I kind of touched on this earlier. It's Medicare Madness, a fun little Halloween themed event that we have going on all day. It's going to take place on I almost said December, October 16th, and it goes over the Medicare claims process, which is great for you new providers, or you're new to Medicare providers, I should say, who have zero knowledge and are starting very base level, because this goes into, this is a lot of detail within the process all in one day. And you can take a look at this and see the description of what it all entails within that one webinar. But again, it would be really great for you new providers who have no idea how the claims process works. So this is another thing that I wanted to show you, just to make you aware and put it on your radar. I think it'd be really fun. Like I said, it's Halloween themed. My favorite holiday is Halloween, so I can't help but be biased, but those are the things that I wanted to show you. And again, these are all great resources to take advantage of. This Medicare and You, I just showed you that. Claims processing contacts are a great one to have, a resource to have, because like I said, we don't deal with Medicare Advantage, so I do want to point you in the right direction. Medicare Advantage plans, this might be the link that I just showed you. Yeah, this is the link I just showed you on the screen. But yeah, and then this again, compare original to Medicare Advantage if you want to, if you for some reason lose this handout, I'm pointing you to resources that you can look at for future reference. Okie dokie, Mary, I'm going to open the floor. Have there been any questions?
Bailey, we've just had a couple of questions, and I was able to answer those as we moved along throughout your presentation today. And it's a question we get often, so I just do want to mention it, just in case that someone is not actually viewing the presentation today. Some of you may have joined via telephone only, and you're following along in your in your handout. So the question was whether or not Medicare Advantage plans have to follow policies that traditional or original Medicare uses. And the answer to that is yes and no. Medicare Advantage plans do have to follow the local policies written by the MACs. So if WPS has a policy in place for procedure XYZ, then the Medicare Advantage plan has to follow for beneficiaries in that jurisdiction receiving those services, the same services. They have to follow that local policy of the MACs. Other policies such as National Correct Coding Initiative edits are voluntarily followed by some of the Medicare Advantage plans, most of them, yes, but not all. They don't have to, but most of them do. So for that, you know, to see if a Medicare Advantage plan has to follow MUEs, for example, medically unlikely edits, those thresholds on the number that they can bill on one day and receive payment for, under most circumstances, that is, I would check with the plan. So, and I also wanted to mention, Bailey, and I'm not sure because I was busy typing answers or typing things into the chat while you were talking. So I'm listening with both ears, but sometimes I'm thinking about what I'm typing so much I don't necessarily hear you. One really cool thing, and that I think we're doing with this Mediscare Madness that's coming up on 10/16, is that a few days later we are offering that follow-up Q&A session. The last time we offered this, you know, we ran a little short on time in that question and answer session. So I wanted to let all of you know that those changes are coming about based on your survey feedback. People said we wanted more time for questions. So we actually scheduled a separate follow-up question and answer event on 10/21 called Frights and Insights. We're keeping with that Halloween theme. And I agree with you, Bailey. We've had a lot of fun in the office coming up with descriptions for these and such that Halloween themed. Hoping to have a little fun and share a little holiday fright and madness with all of you. So that's it. I'm talking on here, and I have not received any questions, Bailey. Anything that's unanswered, anything that I need to share with you so that you can address that. So I'm going to turn it back over to you.
Thank you, Mary, and thank you for answering questions as we go. If you do think of questions following the event that you didn't think of during the event, I'll let you know how you could do that later in a little bit, how you can send me those. I will make sure to answer those as they come in. But I'm going to move on since we haven't gotten anything in the chat. So, in a few minutes, you will receive an email with the subject that says, "Thank you for attending." Don't delete it without reading it. This contains your certificate of achievement. The email will look like what you see on your screen here within this red box. That's the certificate of achievement. It's not a PDF. It's not something separate. This is it. It contains everything that you need for CEUs, your name, contact hours, everything you need. If you don't see it, make sure you first add the WebEx email address to your safe sender list. Check your spam or junk folders as well, because sometimes you'll get the reminders, but these emails will go to the spam or junk. I don't pretend to understand technology, so I don't really know why that happens, but it does. If you called in from a phone and you followed along on the handout materials and not through WebEx, you'll receive a different email, and that email says, it comes in with the subject, "Sorry we missed you." This is because you did not register with that phone number. So WebEx doesn't realize you've attended because it's looking for your email, that email you registered with. But that's not a problem. Just email wps.gha.education@wpsic.com and put the webinar's name and date as the subject, and just let them know the phone number you called in from, and we can get that certificate to you. That comes like this from the email. Okay, so how I was saying, you will have a chance to send an email or follow-up questions. So if you think of additional questions even after the event is complete, have no fear. You will have 7 days from today to submit them. You're going to send it to that same education mailbox that I've been saying. Mary's been putting it in the chat. The wps.gha.education@wpsic.com, and put today's date and then NTM Part C, new to Medicare, NTM, in the subject line. And this just ensures that the email goes to the right person, which is me. But keep in mind that all claim-specific questions will need to go to customer service. We don't have access to any of that information, so just send any claim-specific questions straight to customer service, because like I said, we don't have access to that information. So please, you'll be receiving a survey. It'll come in that thank you for attending email, or you'll have a redirect after this webinar is complete. But please take a few minutes now to complete that survey. Tell us what you liked, what you didn't like, what we could do better, and suggest topics for future education. It doesn't have to be specific to Medicare. If you think of something that would be beneficial to you in any capacity, just let us know, and because we want to know that. Like Mary was saying, we got survey feedback about our last daily event with our Medicare Education Expo, and we followed those survey comments and added a separate Q&A session. Your feedback really is invaluable to us in ensuring education that is timely and effective. Like I said, there are different options to take that survey depending on your preference and what's easiest for you. There's a link in the chat. There will be a link in the email you receive when we're finished, or when you exit the webinar, it'll look like this picture you see here with the yellow triangle. It's not malicious, it's not nasty, it's not trying to play any tricks on you. It's just letting you know that it's taking you to an external site, which is a CMS site actually. So please, please, please just take a minute and complete that survey and leave me your feedback. I'd love to know what you think. Again, how I was saying that we listen to your survey feedback, this is just more some more examples we want to give you that we have changed things based on your survey feedback. We've added chapters to YouTube where it cuts like chapters of a book, it cuts up the videos. So let's say you're wanting to go back to this specific encore, I will have chapters in there, and let's say you want to go straight to HMO. There's no guessing. I take all of the guesswork out for you, and you can switch straight to HMO because it's marked as HMO. Training indicators, we've added training indicators to our webinar descriptions so you know what you're getting into, and if it's something that pertains to you, like this specific webinar had NTM, new to Medicare, so you know it's for someone who is with 6 months or less education on Medicare, knowledge on Medicare. So we do take these comments seriously when you do send them in, and we do listen to you. And with that, on behalf of myself, Mary, and Provider Outreach and Education, thank you so much for your participation. We look forward to your survey comments and hope to have you join us for future events. Have a great rest of your day and a great rest of your week. You may now disconnect.